Good day, everyone. In this video, we will talk about your reticulocytes and your reticulocyte count. Your reticulocyte is also known as your granulofilamentous red blood cell. So from your multipotent cell to your myeloid cell, then it turns into your proerythroblast, your normoblast, your reticulocyte, and then your red blood cells. So basically, your reticulocyte is a immature red blood cell. So reticulo meaning network, cyte meaning cell. So this is a literal translation of a net-like cell or a network cell. It has your ribosomal RNA. That's why it produces a bluish cytoplasm appearance when you view it under the microscope. The normal value is 0.5 to 2.5%. This is your reference from the Rodax 5th edition. So as the red blood cell develops, the nucleus becomes more and more condensed and is eventually lost during the maturation process. Okay, so again, it is a immature red blood cell. Your reticulocyte lacks nucleus but contains various organelles such as your mitochondria and your ribosomes. So during the reticulocyte maturation, the RNA is being catabolized and the ribosomes slowly disintegrate before they become a mature RBC. So a mature RBC has no nucleus, remember? So the loss of ribosomes and mitochondria will mark the transition of immature reticulocyte stage to your mature red blood cell. In this process, so from your bone marrow, it releases your reticulocyte to your bloodstream, and then it goes to the spleen, here, the purple one, and then after that, it becomes a mature RBC. So all of this process takes only 24 hours. So every day, 1 to 2% of your red blood cells are replaced by your reticulocytes. So in response to anemia, if your reticulocyte production is increased, that means there is a good bone marrow response or an effective erythropoiesis. You also have to take note of this is that the increase in reticulocyte count is not the same as having an effective erythropoiesis. So reticulocytes being released in the bone marrow prematurely are also known as your stress retics or your shift retics. So there is a difference of your reticulocyte being released and a premature reticulocyte being released from the bone marrow. So your reticulocyte count is an indicator of your red blood cell production. It is based on your reduction and or your deduction of total RBC mass. So when you have your reduction, it means that your bone marrow has a problem. While if you have deduction of your total RBC mass, there is leaking or simply bleeding. So when your red blood cell mass is decreased, your red blood cell production is also decreased. Therefore, you have increased erythropoiesis. That results into increased erythropoiesis to compensate. On the other hand, if you have increased reticulocyte count, so there will be a decreased red blood cell production just for it to balance. Okay? An elevated reticulocyte count accompanies shortened RBC survival, which is why we have what we call your reticulocytosis. So this is your table for the normal range of your reticulocyte count. For adults, we have 0.5 to 2.5%, while for newborns, you have 0.8 to 5.8%. Note that for newborns, this is only applicable for the first 24 hours of their life. We now proceed to the staining of your reticulocyte count. We first have your right stain. So your peripheral blood smear is stained by your right stain, and then it will demonstrate a slight blue tint in the red blood cell. So this morphological condition of your red blood cell is known as polychromatophilia. So your stress reticulocytes are recognizable by the larger size compared to a normal RPC. You can see in the slide, it is very hard to identify reticulocytes in your right stain. So on the other side of the image, you can see it under the new methylene blue. So, di ba, mas madali siya tignan dito kasi very defined yung laman ng cell. So next, we have your supravital stain. Under your supravital stain, we have your new methylene blue and your brilliant crescent blue as your stain. So this is to differentiate your normal RBC from your reticulocytes. So the stain will precipitate the ribosomal RNA to form a deep blue color. So it exhibits mesh-like network of ribosomal RNA around inside the cell. Again, from the picture from the last slide, as you can see, it very defined siya once you use your supravital stains. We now proceed to the methods for your reticulocyte count. So first, we have your light microscope. So under your light microscope, this is your formula. So the number of reticulocyte count that you have counted over 1,000 RBC observed multiplied by 100. Next, we have your Miller disk method. So, again, dun sa light microscope, di ba, you have to count at least 1,000 RBCs. So, this one is this method was made to reduce the labor of intensive process of counting up to 1,000 red blood cells. So, this is attached to the iris of the microscope, and then your field is composed of two squares. So, a smaller square or a 1/9 of the area of the larger square is used to count your RBC, and a larger square is used to count your reticulocyte. So in the next slide, you can see what it looks like. So in here, again, your larger square or your A square, this is where you count your reticulocyte. And on your B square, the smaller one, this is used to count your red blood cell. So a minimum of 112 cells should be counted in the small square because this is equivalent to 1008 red blood cells in the large square. So once you compute it, it's 112 times 9 would equal to 1008 red blood cells. Again, what do we need? We need to observe 1,000 RBCs, right? So, if you use this method, this will satisfy the standard reticulocyte count based on CAP or the College of American Pathologists. So, the formula here is your number of reticulocyte count in your large square over your red blood cell in small square multiplied by 9 times 100. Next, we have the preparation of your smear. So we need to mix an equal amount of blood and your new methylene blue or your supravital stain and allow it to incubate at room temperature for 10 minutes. So at incubation, the stain will precipitate the ribosomal RNA. So you use 2 to 3 drops or 40 to 60 microliters. So for your counting, you need to count 1,000 RBCs under your OYO. So reticulocytes are counted both as your red blood cell and as your reticulocyte. So first we have your absolute reticulocyte count. So the formula here is your retic multiplied by your RBC count over 100. So the normal value here is 20 to 115 times 10 raised to 9 per liter. Okay. So traditionally, reticulocyte count has been expressed as a percentage of the total number of circulating red blood cells. Kaya yung reticulocyte count natin kanina, ang unit of measurement natin is percent. However, that value may be erroneous because there are fluctuations in the percentage. That is caused by a change in the total number of your circulating red blood cells. So, it's not the real count of your reticulocyte. It is only a proportion, it is only a percentage. So to account for those variations caused by your erythrocyte quantity, ARC is preferred than that of percentage reporting. So your ARC is a marker of red blood cell production, and it helps in distinguishing proliferative anemia, both hypoproliferative and hyperproliferative anemia. So the higher the value of your absolute reticulocyte count, the more severe the anemia is. Next, we have your corrected reticulocyte count. So in anemia, the retic count will be artificially high. Okay, so for example, in this first box, your red blood cell quantity is higher. So, and then you have example 2% of your retic count, while on the other image, you have less or you have decreased red blood cell quantity. So, your reticulocyte count is considered as 9% since again, it's only a percentage, right, of your total red blood cell mass. Okay? So, it's not correct. Kasi same lang sila ng number of reticulocyte, pero different yung RBC count nila, so nagdi-differentiate siya. Okay? So, this is what we use then. So, for example, your hematocrit is 15, and then what is the normal hemoglobin? It is 45. So, that is constant. So, we do hematocrit over normal hemoglobin multiplied by the reticulocyte count that you got. Okay? So, example, for this box that has less red blood cells, so it's 15 divided by 45 multiplied by 9, and then you get your 3%. So that will be your answer. In cases where the patient's hematocrit ranges from 26 to 34, the normal value we should follow is 2 to 3%. Okay? Again, 35 or greater, 2 to 3%, while pag less than 25 siya, you use 3 to 5% as your normal value. Next, we have your reticulocyte production index or your RPI. So reticulocytes that are released in the bone marrow prematurely are being shifted from, again, the bone marrow to the circulation earlier than usual. This is to compensate with your anemia or blood loss. Okay? So just like other normal reticulocytes, these cells approximately take 2 to 3 days before they lose their reticulum. So when erythropoiesis is being evaluated, a correction should be made for the presence of your shift reticulocytes, especially when polychromasia is reported in the RBC morphology. So most normal reticulocytes or the non-shift reticulocyte, they become mature red blood cells within 1 day. So after entering the blood smear, ayan, naging red blood cell na sila. They mature na within 1 day lang. So for your shifted naman na reticulocyte or your shifted reticulocytes, it takes more days for them to mature. Okay? So for this reason, that is why we compute for your reticulocyte production index. Okay? Kasi if you don't compute for it, nagiging falsely increase your reticulocyte count because of the polychromasia. Okay? So the RPI calculates the reticulocyte that is non-shift cells. Okay? That is why there is also a normal value ng pang-corrected and yung not corrected na reticulocyte count. Okay? So for your RPI, the formula is your CRC or your corrected reticulocyte count, yung percentage over maturation time or the days. Okay? So you have more than 3, that's adequate na. If you have less than 2, it's inadequate, the production. Here you have your table. This is the correction factor para sa sa days, okay? So if you have 40 to 45 na hematocrit, automatically you get correction factor of 1, okay? The list goes on. Next, we have your sources of error. So you have your anemia, polycythemia, unmixed blood and stain before the film preparation. So you also have your red cell inclusions, specifically your Heinz bodies, Howell-Jolly bodies, and your Pappenheimer bodies. So one more is your edge rule if you're using the Miller disc method. So first you have your anemia and your polycythemia. So what we do here is we adjust the proportion of your dye and your blood sample. So if you have anemia, you increase the volume of the blood sample. So if normally 2 drops siya, 2 drops blood, 2 drops dye, we do 3 drops blood and then 2 drops dye. Okay? Well, for polycythemia, we decrease the volume of the blood sample or you increase the volume of your dye. So we have pwede siyang 2 drops blood sample and then 3 drops of your dye. Okay? So for your unmixed preparation naman, the reason for this is that your specific gravity of the reticulocyte is lower than that of the mature red blood cell. So your reticulocytes are above the mixture. Okay? So it is very important to mix the solution for it to homogenize. Okay? Para mag-mix talaga siya. Okay? Kasi once you if you don't get the sample properly and then, yun nga, it's unmixed, the preparation, nasa taas yung reticulocyte, wala kang makakount. Okay? It's not correct. What you're gonna get won't be correct anymore. Next, we have our Heinz bodies. So this is a result of oxidative damage to the RBC hemoglobin. So it is primarily caused by hemolytic anemic process. So the reticulocytes has a diffused dot, while Heinz bodies are concentrated at one side. So in here, you can see at the image, so they are very different. So reticulocyte, maliliit sila na parang granules inside the cell, while your Heinz bodies, ayan, it's concentrated at one side. So you use supravital stain for the identification of your Heinz bodies. We have your Howell-Jolly bodies. So this one is a basophilic nuclear DNA remnant in circulating RBC. So in some cases, a small portion of the nuclear DNA remain in the erythroblast after maturation. So there is a dark purple or dark blue purple in color, and they are usually one lang sila per RBC. So you can identify this through your right stain. So did you see the difference? Kanina, Heinz bodies, they are big tapos concentrated at one side. This one naman, one lang din siya, pero it's smaller. And again, you have to take note of this. You can see it in your right stain. Last, we have our Pappenheimer bodies. So this is a abnormal basophilic granule of iron. So it is also found inside the RBC and is usually seen also in your right stain. Yan. Ganyan naman yung itsura niya. In your right stain. So for the next one, we have the factors that increases your reticulocytes. So you have blood loss or anemia, hemolytic anemia, high altitude, and your pregnancy. So for pregnancy, we have your hemolytic disease of the fetus and newborn. So there is premature intravascular hemolysis brought about by antibodies present in the mother of the fetus. So naglalaban sila, that's why there is a hemolytic process that happens. So intravascular autoimmune hemolysis would show your bone marrow to release shift reticulocytes. Next, we have your high altitude. So oxygen level is depleted if you're in a high altitude place. So your bone marrow will release shift reticulocytes to counterbalance the depleted oxygen. Okay? So, kina-counterbalance lang ng bone marrow mo yung oxygen level. Okay, now we move on for the decreased reticulocytes. So, examples of this are your aplastic anemia, pernicious anemia, IDA, iron deficiency, and folic acid deficiency anemia. Also, we have your exposure to radiation, chronic infection, and drugs and chemicals. For your aplastic anemia, remember, in aplastic anemia, your bone marrow is the problem. So there are no precursor cells for production of your normal blood cells. Therefore, decrease talaga yung reticulocytes mo. We have your pernicious anemia, IDA, FA, and your exposure to radiation and your chronic infection. So we have to remember here that your vitamin B complex is important for the production of your red blood cells. So if mababa yon or wala yon, it leads to the absence of precursor cell for DNA synthesis. Okay, so for radiation, yung chronic infection also, it affects your vitamin B complex in your body, therefore having decreased reticulocytes. Lastly, we have our drugs and your chemicals. So there are two. So these drugs are among the leading cause of your aplastic anemia. So these are benzene and your chloramphenicol.